Hey, I'm Isaac. We're doing our dementia project here, and we'll have everyone introduce ourselves. I'm Isaac Mitchell.
I'm Riley Levereau.
I'm Tyler Marsh.
I'm Sydney Moses.
And I am Isaiah Ross.
Okay, so I have the first section, so we're going to get started here. We're talking about William Welka, who's a 72-year-old patient, and he was admitted because of confusion to the hospital recently. And so I'm just going to go through a little bit of relevant data from the present problem. I don't think we're going to read all of the info just because we have the handout in front of us. So some relevant data from the presenting problem of the patient. The main thing that I noticed was that he reports seeing his long deceased friend. And the significance of that is that hallucinations or delusions can be a sign of advancing progression of dementia, or it could be from, an additional exacerbation, like a UTI or something else causing him to be confused. The patient is also easily angered and confused, and changes of mental status can be a sign of a UTI, so that might be something that's causing it. He has a diagnosis of type 2 diabetes, and this is relevant because diabetes increases risk of UTI because it can impact bladder dysfunction as well as immune system dysfunction. So those are both things that can, raise the risk of UTI, especially in older patients. And then from the social history, something that's relevant is that his wife has guardianship of him due to his declining mental state and kind of like inability to take care of himself. So that just means she has, legal guardianship over him, and he has some form of impairment when he's doing his like daily living things like that. The family's concerned that he's not safe at home, so he's moved into a long-term care facility, I believe, and especially because of his dementia and some of his other health issues. And he also has three children who visit weekly, and this is important because for older patients with dementia or Alzheimer's or things like that, social interactions, especially with family members, can be really beneficial for treatment. It can be really like stimulating and help them, kind of have a routine and feel more regulated. Yeah, so I'll hand it off to Sydney.
All right, and I will begin at patient care, current vital signs, and the PQRST pain assessment. For relevant vital sign data, I said the elevated temperature of 99.8 is slightly significant. The lower back pain, that's dull, a 4 out of 10, and always there, is also relevant, and the oxygen saturations are also slightly low. The elevated temperature, anything above 99.1 degrees Fahrenheit may indicate signs of the immune system working to fight off an infection, which would correlate with the UTI as mentioned. Lower dull back pain, a 4 out of 10, our patient says is always there, is clinically significant because dull persistent lower back pain may be associated with UTI. And the slightly low oxygen saturations, although they are within normal range, they're relevant for monitoring of the patient since they are diagnosed with COPD and they have symptoms of confusion. So for both of those, for all of those, we want to monitor. And I will pass it off to the next person.
Okay, so I'm doing the mental status examination for relevant assessment data. The patient's pants were soaked in urine. This is significant because having urine-soaked pants is a sign of dementia because the patient wasn't able to recognize when they need to go to the bathroom. Another relevant data is wearing a sweater in the summer, and this is significant because it is a sign of dementia and it shows that they have trouble with decision making and have a lack of awareness of weather conditions. And then also another relevant assessment is shuffling gait. This is a sign of dementia because it can affect a part of your brain that controls coordination and movements. The patient was also easily angered, and this is significant because this is a sign of dementia and confusion from a UTI because they both can cause difficulty concentrating and disorganized thinking, which can make a patient confused and angry. The patient also thought he was at rehab, even though he was at the facility. And, oh wait, no. The patient had hallucinations of an old friend, and the hallucinations is a sign of confusion from a UTI because the infection can affect the brain function. But then he also did think he was in rehab for the facility, which shows that he has poor insight and judgment, and this is a sign of dementia or confusion from a UTI because the patient might not recognize that they are unwell and may not be able to make appropriate decisions, which can lead to poor insight and judgment. The patient also couldn't remember eating or his wife visiting him. So this is like short-term memory, and this is from dementia or confusion from a UTI, because when confusion sets in the brain, it makes it hard for patients to retain new information. He also was not oriented to time or purpose. And so this is a sign of dementia or confusion from a UTI because a patient with dementia can be disoriented from the deterioration of brain function. And a patient that is disoriented from a UTI is because of infection, which is more acute than a gradual decline from dementia. And then also he had suicidal thoughts, and feelings of suicidal thoughts can be a sign of dementia because patients can feel frustrated and depressed because of their lack of remembering things. Okay.
Okay, so I've got the next section with the just the general appearance and respiratory, like cardio evaluations, assessments, things like that. So well, okay, the first one I was a little bit confused about because it says 3+ pulse, which I thought 2+ was normal, but then some of the sources I saw said that 3+ was normal. So that one might not be right, but a +3 pulse means it's full or bounding, which can be indicative of dehydration, which is a risk factor for UTI. And just like Riley was talking about with the mental status evaluation, he's only oriented ×2. So he's not oriented to the date, time, or situation, which is also, a symptom of dementia as well as could be a sign of confusion from UTI. One of them was difficulty falling and staying asleep. So it says that he takes a long time to fall asleep and then wakes up 1 or 2 times during the night. I wasn't quite sure what the connection was. I thought that it might be related to melatonin. When you have dementia, you can have a lack of melatonin, which can cause, difficulty sleeping. But I also know that sometimes, difficulty sleeping or waking up in the night might be tied to incontinence somehow. I wasn't entirely sure with that one. The patient also has urinary incontinence, which again is a risk factor for UTI, especially at his older age. And he has tenting of the skin, which is another sign of dehydration.
And I will take it over with the relevant labs that are significant as a nurse. I found the relevant labs of the basic metabolic panel to be the low potassium, the high glucose, and the elevated creatinine. The clinical significance of low potassium is hypokalemia. The relevance of high glucose is hyperglycemia. And the elevated creatinine is significant due to the reduced kidney function that it shows. The sodium was also part of the metabolic panel, but that was within normal limits. And this trend shows that the patient is stable overall, because none of the values were too high or too low to be critical. For the complete blood count, the relevant data from that assessment would be the low percentage of neutrophils. They are below the reference range of 55 to 7, with their most recent being 52. All the other values are within normal range, and this patient would be stable. For the urinalysis and UA, the relevant labs that are significant would be the white blood cells in the urine. It indicates signs of infections or inflammation in the urinary tract or the infection. relevant labs would also include the trace bacteria, which for the same reason indicates infection of the urinary tract. And other relevant data would be the few epithelial cells. The significance of this is increased amount of epithelial cells in the urine also indicate signs of infection or inflammation. This would be a worsening trend for this patient. Now on to Isaiah.
Okay, so tying together what we've learned so far from the labs and the assessment so far, we come to the conclusion that this patient is suffering from some sort of neurocognitive disorder, most likely Alzheimer's. So dementia is a progressive cognitive and memory decline that hinders one's ability to complete activities of daily living. Alzheimer's is a disease which is a unique form of dementia with a genetic predisposition and the accumulation of beta amyloid plaques in the brain being responsible for the disease. I also found that research shows the lack of the neurotransmitter acetylcholine also playing a role in the development of this disease. So the issue that he's having is a gradual neurodegeneration over time. And so looking at some of the medical management here, we have a neuropsychiatric evaluation. This would be a series of assessments that would determine if the patient is experiencing a mental illness. So in this scenario, we would use this evaluation to rule out other possibilities for clinical presentations such as delirium, which can often be mistaken as dementia because it manifests itself similarly. We're also going to do a urinalysis. This would rule out the possibility of a UTI, which also presents with confusion. This patient is going to be taking haloperidol, 25 milligrams by mouth. This patient is experiencing agitation and visual hallucinations of a friend that is no longer alive. So the goal of this medication would be to reduce the symptoms of agitation and psychosis. He's also going to be taking acetaminophen, 325 milligrams by mouth. The patient was also reporting back pain. So the goal of this medication is to reduce the client's moderate to severe lower back pain. Insulin glargine. So the client suffers from type 2 diabetes, which means his body has developed a resistance to insulin. Management of the goal of the insulin is management of diabetes by giving cellular access to glucose through long-acting insulin injections. So increase memantine by 10 to 10 milligrams by mouth daily. So the client was showing signs of Alzheimer's disease and neurocognitive decline. This medication is commonly increased in 10 milligram increments daily after they initially start the medication. So the objective would be to treat the client's Alzheimer's symptoms of neurocognitive degeneration. Donezepil, 5 milligrams by mouth. This medication is also used to treat dementia. It's more broad. It's not only used in Alzheimer's, but most often it is. It works by increasing acetylcholine in the brain, and its goal is to improve neurocognitive function. And then trazodone. The patient stated that he may walk off into traffic if not allowed to leave the facility, and show sign of increasing anxiety. So this medication should reduce the client's anxiety and agitation and prevent depressive manifestations such as suicide.
Okay, so I had collaborative care, and some of my priority nursing interventions are antibiotics and pain management. For the rationale, there are currently no listed antibiotics to battle this patient's UTI. It is important to treat UTIs promptly as to not reach serious complications such as septic shock and renal scarring. The expected outcome for this would be the UTI comes to a conclusion, which is measurable by the decrease in white blood cells and epithelial cells in the urine by the end of the week. And for the patient's pain management, the patient listed pain as a 4 out of 10, but also states that it's always there. This pain should be managed during the stay by medication. Physical therapy could also be called upon to treat if it's a musculoskeletal issue involving chronic pain. It's hard to tell off of the assessment data whether or not the patient had this pain prior to coming in, or if it's due to the UTI or what. But further assessment may need to be taken as it could be related to this UTI. And for the expected outcome is that pain is managed by medication and will not exceed a 2 during my shift.
Okay, so I did the psychosocial priorities, so priority nursing interventions, encourage family and friends visiting, because dementia patients having the presence of family or friends have shown decreased agitation and confusion. Also encouraging and providing information about the activities they can participate in at the Pineville Estates. This can help improve their quality of life by increasing their mood and relaxation, and administering all drugs as prescribed. This helps the patient to function optimally. This includes improved mood, reduced pain, as well as reducing health complications. And the expected outcome would be the client experiences minimal to no agitation and mood is enhanced.
Okay. The educational and discharge priorities are knowing the symptoms and medication for the patient and family. It is important for the patient's family to understand common manifestations of his diagnosis. Dementia can bring a wide range of symptoms like mood changes, confusion, memory loss, and language issues or speech issues. This can help family members to better communicate with the patient and understand the importance of having patience when working with these symptoms and to understand kind of what the patient is going through. Other education is on medication. Medication education is important due to the patient's declining mental status. Educating both the patient and his family members is important in attempting to make sure medications are taken on time, in the correct manner, and at the correct dosage. Medication self-administration errors are really common, and one study states the frequency of MSEs in the last 6 months was 62% over a rather large study that's listed. This coupled with the patient's dementia diagnosis may make medication administration difficult for both him and family members. So just making sure they know what is expected for each medication is important.
Yeah, great. Thanks for sharing, everyone. Does anyone have any questions or any topics they'd like to, circle back around to before we close it up? All right. Well, thanks so much. Bye.
Thank you.
Thank you.
Thank you.